So today we're going to talk a little bit about PRP in our clinic. For those of you that don't know, that is our platelet-rich plasma treatment. Now, PRP, I'm pretty sure you must have heard about it. It's very good for skin. We use it in all sorts of settings, orthopedics, aesthetics, hair restoration. It's really a wonderful treatment. But what makes ours a little bit different is that if you are prescribed the PRP treatment, we are going to optimize you from day one. I always tell my patients, I can only give you plasma as good as I get because we are drawing blood on the day. So usually we try and make sure that the patient's blood work is correct, we check any vitamin deficiencies, and if there are any present, we correct them before we undertake the PRP treatments. One of the things our clinic also offers is that our PRP treatments have different delivery methods. So you can have your PRP done with microneedling, so that's where we microneedle the plasma into the head, or you can have PRP injectables, which is the injected version directly into the head, similar to a Botox injection, definitely not painful. Those are the two ways that we do PRP in our clinic. So as mentioned previously, we like to optimize our patients before PRP. That means we also provide you with a list. On that list, it tells you about any medications that if you are taking them, when you need to come for PRP after those medications have stopped, if you've had any recent illness, any knock to the immune system that would affect our plasma quality, we are going to advise that we defer treatment for those. So at consultation, our specialist will generally advise you how many treatments are needed to reach the desired goal. But our clinic also offers follow-ups in between during courses of treatment, just to make sure that we are on the right track, we are still achieving what we are aiming to achieve. If there's any trouble that we need to perhaps address an issue or correct something, we generally do that during the course of treatment so that not to affect our results in any way. Usually in our clinic, your client follow-up will be done at the end of a course of treatment, which is generally about 6 to 9 months. And at that follow-up visit, you and the specialist will ascertain whether you have achieved the desired result, or if we need to perhaps get more density, increase a little bit of the hairline, whatever the case may be. And that's where we will troubleshoot and we will try and rectify any issues. Most patients, after their follow-up visits, they're pretty happy with results, and we then put them on our maintenance course of treatment. Depending on what hair condition we were treating, your maintenance can differ. Some patients have maintenance where they do a microneedling treatment once every 3 months. Some patients opt for a PRP maintenance package. It all depends on which hair condition we're treating. But we make sure that even when you have achieved the result that we're looking at, you are still happy with it. So for most of the patients, we'll generally tell you to avoid your sweating, swimming in sunshine straight after treatment and for the first 24 hours. We also suggest you don't wash your hair or apply any product for the first 24 hours, just because there is an open lesion. The skin is very vulnerable and we don't want to cause any more issues. We also advise the patients that if they are using minoxidil, we ask you not to apply your minoxidil for a couple of days, also just to give that skin a chance to heal before we apply any other chemicals. Aftercare is pretty simple. Most patients don't have any downtime after treatment, usually the afternoon, no headaches, no pain. That's what we pride ourselves on, not having any painful treatments. So our patients generally do well with their aftercare and no complications are experienced afterwards.